Welcome to the Affordable Care Act Made Easy. My name is Greg Howard. I am a licensed insurance broker and a Affordable Care Act specialist with USA Benefits Group. This webinar is for specifically for employers. I want to thank all of you for joining us today. I have muted the call so that we don't have any background noise, that type of thing. We do have a webinar that we offer for employees and self-employed and individuals that occurs at 7 o'clock Central Standard Time on Thursday evenings. So if you have some interest in that, we invite you to join us for that webinar. Today we're going to talk about what employers' obligations are, what's going to happen in 2014 and then further on into 2015, and try to give you a sense of what the timing is for all of this and what the responsibilities are for employers. As I said earlier, I've muted the call, so if you have any questions, please make note of those because we'll take questions at the end of the webinar. We are recording this webinar, so if you need to go over it again, we'll be presenting lots of information. So if you need to go over it again, it'll be available at the website usabenx.com under the webinars tab. So let's get started. First of all, we want to address some of the recent changes in the Affordable Care Act that affect employers but are not affecting the employees at all. What's changed is that the employer mandate was delayed until January 1st of 2015. And what that means is that there's no penalty for any size business in 2014 that's not offering ACA compliant health coverage to their employees. It also eliminated the reporting of employee insurance information to the IRS for 2014 as well. What has not changed is the individual mandate. It is going to still be required that as of January 1st of 2014, that every American have ACA compliant coverage or pay a penalty. What all of this means to employers is that every employee you have must still have ACA compliant coverage as of January 1st, even though you're not required to supply it. So the employers in 2014 actually have two no penalty options under the ACA plans. One is group health plans, and the other is the optional defined contribution plans. So the first big question for employers in 2014 is, should I offer group health insurance to my employees or not? Factors that'll go into that decision are the size of the group, average income for the employees, and the costs of the group premiums versus some other options that are available. With regards to group health plans, several things are becoming apparent to us. Group is becoming more and more expensive. For any of you who have that, you know that cost sharing is going up, the rates are certainly increasing, and deductible maximums are increasing. Regulations are more and more burdensome, causing employers more dollars in overhead, including management of COBRA plans, and the value to the employees is decreasing. And in fact, with the new healthcare laws, actually offering group and health insurance may be blocking your employees from accessing their federal subsidies. In general, for a group plan to compete with the subsidies of the federal government, the employer needs to be prepared to pay 100% of the employees' coverage and somewhere between 50 and 80% of the family coverage just to compete with the subsidies that the federal government is supplying. The alternative to the group health plans is private exchanges like the USA Benefit Exchange. Employees have the choice of the best plans available on the market. They have more choices than those that are available on any public exchange. They get to talk to a licensed health insurance expert, and they can do that in English and Spanish currently, and by the end of August, they'll be able to do that in close to 100 different languages. So whatever language your employees speak, it's likely that we'll be able to assist them. And employees can receive a generous subsidy to help pay for their plans, and all of that at no cost to the employers. So for those of you who are currently offering health insurance plans, think about what you would do with all the money that you're currently spending on group health plan premiums, and the management of COBRA. To add some clarity to this, I'd like to go through an example of a family of four that makes $55,000 a year. The employee-only health insurance averages $5,400 a year across the country, and the family coverage averages $14,556. Now, the minimum contribution from the employer is $175, and that leaves the employee's contribution at $14,381. But in reality, the employers are typically required to pay at least 50% of the single employee-only coverage, and so that's about $2,700 a year, with leaving the employee with $11,856 to cover his family. Now, if the employer is a little more generous and covers 100% of the employee's coverage, then the employer contribution would be $5,400, leaving the employee still with $9,156 to cover his family of four. If the employer then decides to also help out with the family and pay 50% of the family coverage, then the employer's contribution rises to $7,278 and leaves $7,278 as the employee contribution to cover his family. If, on the other hand, the employer decides to offer no health insurance to his employees, but offers them a private exchange like ours, and by the way, private exchanges can be private labeled for your own company, or you can use the USA Benefit Exchange, either one. But if the employer decides not to offer health insurance and route people through the exchange, then depending on how many people they have in their employee, if it's 50 or less, they have zero to pay. If it is more than 50 or more, then come 2015, they'll have $2,000 per employee to pay, but in 2014, there's no charge at all. So for 2014, the number here is zero, and the employee pays $4,135 to cover his entire family, with the government providing a subsidy of $10,421. As you can see, it is both cheaper for the employer to not offer health insurance to their employees, and it is cheaper for the employee to be able to cover his or her entire family. This is probably a good time to talk about the fact that the impact of the new health care laws is to change what real benefits are. Our obligation as employers, we have a moral and ethical obligation to do what's in the best interests of our employees, if that's at all possible. And with the new health care laws, in many cases, what is in the best interest of our employees is not to offer health insurance, but to allow them to go to a private exchange and get their benefits and their subsidies from the federal government. To help you determine the impact of group health plan versus defined contribution plan, we have provided a calculator at usabenx.com. You click on the Calculators tab and select the Group versus Defined Contribution comparison. And there you can put in your own numbers to see what plan works best for your company. An example of the calculator is shown here. And as you see, you can put in the number of employees you have, the average salary for your employees, the average age, the percentage of the premium that you pay for your employee, percentage that you pay for spouse or family. And the numbers then shown here, 467, 427, and 844, those are the average numbers across the United States for premiums in 2012 for an employee. And then the 467 is for the employee. The 427 is how much you would add to the employee's premium for a spouse. And the 844 is how much you would add to the employee's premium to cover the entire family. You also get to kind of look into your crystal ball and try to figure out what you think premiums are going to go up come January 1st. The Congressional Budget Office tells us that they think that premiums are going to double come the first of the year. But for this case, we've only picked 25%. The next number down here is if, for example, you decided that you were not going to offer health insurance to your employees, that it was in their best interest not to do that, then the question is, how much would you be willing to put into, say, an HRA, a health reimbursement account, to help them pay for other benefits like dental and vision, critical illness, accident, long-term care, short-term disability, long-term disability, those kinds of things. In this case, we've picked $100, and then we ask you to estimate your corporate tax rate. And once you've done that, at the top of the page, you'll see that there is a button or a tab to click on that says Results. The Results tab will show you a comparison of exactly what's going to happen to your employees and to the company. In this case, a single individual, because the company was paying 80% of their premiums, the single employee is going to pay about $105 more than they have been under the employer-sponsored health plan. Family of two, though, will save $441 a month, and a family of four would save $1,057 a month. Now, notice that every employee gets an additional benefit of $100, which begins to wipe out the overage for the individual. And the company, after any penalties, taxes, HRA expenses, any of those things added in and taken out, the company still saves almost $324,000. And that's on 100 employees. So that takes it down to about $3,300 per employee that the company is saving. We ran another example here on a little smaller company with a little more conservative numbers for premiums, still $35,000 for the average income. Average age is a little younger at 30, and the company's covering 75% of the employee's premium, none of the families. In this case, we set the average premium for the employee at $300, $270 to add the spouse, and $600 to add the family. Kept the increase at 25% and left $100 for an HRA with the same corporate tax rate. In this case, the individual pays about $128 a month more than they did under the group health plan. The family still saves $221, family of two, and a family of four saves $729 a month. Each employee or employee group or family group receives an additional $100 benefits in terms of dental and vision and those kinds of things, and the company saves $38,000, almost $39,000 after taxes and penalties and HRA contribution and all of that. So in this case, it's about $1,500 per employee that's saved. As you can begin to see from these examples, in many, many, many cases, it is both to the employee's benefit and to the employer's benefit not to offer health insurance, but to opt to go to a defined contribution plan and allow the employees to go to a private exchange. One of the questions that many employers have is, well, if I do that, what are the options for my employees on the exchange? Well, factors that affect that tend to be the size of the family and the household income. Households with incomes between 100 and 400% of the federal poverty level qualify for a subsidy from the federal government to help pay their premiums. This chart shows households anywhere from size 1 to 8 and their corresponding levels of income for 100 to 400%. So an individual that makes $11,490 up to $45,960 qualifies for a subsidy. Family of four can make up to $94,200. And I have a good friend of mine who is, he and his wife have 5 children. So in their case, at a household of 7, they could make up to $142,440 and still get a subsidy from the federal government. With premiums going up substantially, one of the questions I get on a regular basis is, how much are these subsidies? So here's a good example of a family of 4 with a $60,000 income. Mom and dad are both 40 years old, and they have 2 children under the age of 21. The federal government thinks that their subsidy or their premium for a silver plan will be $1,102. But they think that they can't really afford that, so the federal government's going to subsidize $693 of it, and their monthly premium is only $409 to insure their entire family of four. This chart shows a comparison of a family of four at four different income levels. As you can see, from $35,000 up to $90,000, the federal government is providing substantial subsidies for all these folks, anywhere from $988 up to or down to about $389. Even at $90,000, the federal government is subsidizing about a third of the cost of health insurance for this family of four. The next question I want to address is why choose a private exchange over a public one? You notice that all along I've been talking about accessing a private exchange, and there's some important differences for you to understand. Public exchanges will be run either by the local state or by the federal government. In Kansas and Missouri, locally here, they'll both be run by the federal government, and they will be staffed by navigators. Navigators are folks who are trained to help people fill out the paperwork for their subsidies and to fill out the paperwork to apply for a health plan. But they cannot, by federal law and state laws, offer any advice on insurance products as to which plan might best fit somebody's particular situation. Private exchanges, on the other hand, are going to be staffed by licensed insurance agents like myself. Public exchanges are going to be limited in the number of plans that they offer. A number of carriers, including United Healthcare, Cigna, and Assurant, have all announced that they will not be on a single public exchange in the United States in 2014. So if you want to buy United Healthcare, you almost have to buy it on a private exchange or directly from the company. So the private exchanges are going to have all the plans that are available on the public exchange, and in addition to that, they'll have United Healthcare, Cigna, Assurant, and a whole list of others. The cost of the plans are exactly the same on either a public or a private exchange, and that again is by federal law, and subsidies are available on both exchanges. So the advantage of using a private exchange is that you get better advice, more plans, the same pricing, and exactly the same subsidies. So this slide really summarizes it all. As employers, you can offer affordable, ACA-compliant health insurance to your employees at zero cost to you. If you currently offer health insurance to your employees, what would you do with all of the money that you save on premiums? And if you don't currently offer health insurance to your employees, could you hire and retain better employees if you offered health insurance? I think you know the answer to both those questions. So what are you waiting for? The final question for the day is, how can I get more information? Whether it's to find out how to get your own private labeled exchange for your company, or how to get access to the USA Benefits Exchange and direct your employees there, and what other options might be available for them in terms of critical illness and accident and disability and dental and vision and those things. Well, the answer to that is pretty easy. Just contact the USA Benefits Group agent that invited you to this webinar. If you don't have a USA Benefits Group agent right now, you can always go to usabenx.com and click on the ACA Employer Advisor tab. There's a form there to fill out, and once you've done that and submitted it, we'll have someone contact you to guide you through the process. I hope this has been helpful. If you need to review this material again, we're going to post this webinar up on the usabenx.com website under the Webinars tab so that you can go back and review this anytime you need to. Feel free to contact us if you need additional assistance. You can call our office at 888-427-3270. That's 888-427-3270.